Gentlemen, before we get into today's episode, I just want to remind you about this amazing knife that we've got that we're giving away. We're going to give this away early in Season 7. So we're going to give everybody a chance to sign up to win it if you go to manlihood.com/contest. This knife is from my amazing friend at Haynes Knives. You can see him on social media at Bird Forge. He made this for us. It's called the Black Pearl. It is a gorgeous everyday carry knife. And it was forged just for us to do for this giveaway. So it is amazing. It feels great in your hands, and I can't wait for you to own it. So go to manlihood.com/contests. You can sign up for it there. It's free to enter, but if you want to have more of a chance at winning it, you can buy extra chances there on the website as well, manlihood.com/contests. And don't forget to check out Haynes Knives, which is HAINES knives.com. Guys, today's interview, we've talked with this guest before. In fact, I've promoted his supplements. Affirm and Support are some amazing supplements that he's got available for men. And he's got some amazing insight now into something that most of us men didn't think was possible. So if you want to learn about the work that he's doing to help with men's health, this interview is definitely for you. So check out this interview with Dr. Judson Brandeis. Hey, Doc. It's so great to have you back on the show again. How are you doing?
Oh, I'm doing great. Thank you so much for having me back.
No, we're glad to have you. We really enjoyed the last conversation we had. We had some great feedback on that interview, and definitely excited to have you on again, especially because you've got some exciting things that have been happening lately, right?
Yeah, we're going to take this one to the next level.
Awesome. I can't wait. So, Doc, in case anybody hasn't listened to the past episode, which we will encourage them to go back and listen to, maybe you could describe a little bit about the work that you do and what qualifies you to talk about it.
Sure. So I really focus on men's health for men basically over the age of 30. And men's health in this country is really a catastrophe. We're living less long than we used to. And women's health is improving, men's health is declining. And we're dying of suicide, alcoholism, opioids, really diseases of despair at a rate that far exceeds anything that we've ever had before. And so really I'm focused on sexual health, hormonal health, and then really overall health for men, helping men make decisions that will really have a positive impact on their life.
Yeah, I think that we often think about men's issues as psychological or emotional, but so much of it does tie in with your mental health and even your sexual health.
Absolutely. I mean, everything's all tied together, of course. When you're young and you're in shape and you're vigorous, you feel fantastic. You feel indestructible. But the problem is we're not indestructible forever. And so you have to really prepare for the years when you're not indestructible.
Yeah. Well, and what's funny is your brain isn't fully formed, and so that indestructible thinking is literally part of the way you think. So you end up sabotaging yourself.
Exactly.
Yeah. If I would have known that all those Cheetos and Doritos and Mountain Dew would affect me the way that it did later in life, I would have been like, because I could pound down the food and I didn't gain a pound, and then all of a sudden it was like, wait, where did that come from? Totally screwed up my metabolism.
Yeah, exactly.
So when you were on before, we talked quite a bit about your book, To the 21st Century Man, which I see is behind you on the shelf, which is really awesome. Have you had any good feedback or any good response from that book as it's been out there?
Yeah, I mean, we've really had incredible response. And it really, my patients and my readers have sent me emails really telling me that it's transformed their life.
That's awesome.
It's really changed that. The thing is, and it's a big, thick book, and I encourage people not to read every chapter, right? Because not every chapter relates to every person, but it's such a big book because I've seen men with every single problem we talk about in the book. So it's meant to be all-encompassing, but each person's book isn't 900 pages. Each person's book is 200 pages or 300 pages. Really, each chapter is only 5, 6, 7, 8 pages. Really focusing on exactly what you need to know about those disease conditions.
Yeah, so it's like a reference book is kind of how to approach it.
Yeah, it's kind of like a reference book. It's more of an advice book. Like if your next door neighbor was like the top dermatologist in town or the top cardiologist in town and you went over for some free advice, this is the advice that you would get.
That's awesome.
Them.
I have a buddy who's an EMT and a nurse, and I call him all the time for that kind of advice. He's like,
yeah, exactly.
It's like a buddy who just recently had like a surgery and he had to get his dressing changed and his wife freaked out. So we all call that buddy. And he comes over and changes everybody's dressings at home.
Yeah.
It's all off the clock stuff, you know?
Yeah. I mean, like one of my good friends is Mike Murphy, who just so happens to be an ear, nose, throat doctor at Stanford and an expert in sleep. So he wrote the sleep chapter.
That's awesome.
Yeah. So, I mean, you know, one of my really good friends is Ahad Mahuchi, who's the top ophthalmologist in Florida, has done like 30,000 eye surgeries. And so he just wrote the ophthalmology chapter.
You know, that was actually something that I found interesting. And in our discussion, we talked about it too. Like, I recently had eye surgery and I don't have to wear glasses anymore. And you had talked about how men don't wear safety goggles, right? Just like, and then they get eye injured.
Because we're indestructible, right?
And so I'm so used to having to wear glasses all the time. So I was cutting with my saw the other day. I got a piece of sawdust in my eye. I'm like, daggone it, I should have listened to Dr. Brandeis.
Oh. Yeah, I mean, but imagine if that was like a little piece of metal, you know, you had the sawzall out in the backyard cutting a piece of wood, and all of a sudden you go through a nail that you didn't see in the piece of wood, and all of a sudden a metal splinter comes rocketing out and sticks right in the middle of your eye.
And you're right in that we just assume we're not going to get hurt. Like, oh, I've done this 1,000 times. I'm not going to get hurt, you know? And no, that doesn't always happen that way.
I mean, I tell my patients something that happens 1 out of 1,000 times happens to one person.
Don't make it be you. Be smart.
Yeah, do you want to be that one person?
So I know that you are primarily working in the area of sexual health, and you know, you're a urologist by trade, actually an accomplished urologist, which is pretty cool. I was Googling as I was writing the description for our last episode, and I'm like, yeah, this guy's legit. But so
I've done a lot of cool stuff, I'll put it that way.
And you're pioneering some new stuff right now, which I think I'd really like to kind of talk about if we could.
Yeah, this is really interesting because when you do surveys, more than half of men say that they want a longer penis. And the other half are lying.
Right.
And so, but the thing is, most of us don't do anything about it. But there are a subset of folks that actually do things about it. And so there are physicians out there that will inject fillers into the penis, or will do fat transfers, or do a surgery which cuts the suspensory ligament, the ligament that hangs the penis so it hangs lower. Or there's even now a procedure where you put a silicone, almost like a taco or a hot dog bun, under the skin and above the erectile bodies of the penis, right? And so over the years, I've seen catastrophic complications from all of those procedures, right? And these guys come to you and you feel so bad for them because, they're insecure for whatever reason. Maybe it's something some girl said to them, or something that someone said in locker room to insult them, or whatever. But for whatever reason, their psyche is messed up and they feel inferior. They feel self-conscious. And so then they do something about it, and then it doesn't work out, and they're even worse off. And they've spent, $10, $15, $20,000 to get worse off. And so as a regenerative urologist, as a urologist who focuses now on improving blood flow to the penis using shockwave therapy and PRP and even some exosomes and stem cells, and as a researcher, I said, maybe there's something that we can do that's safe but effective. And so I combined PRP. So PRP is platelet-rich plasma. So platelets in the body have two functions. One function everybody knows, right? Cause a clot. But the second function, most people don't know, but what that function is to cause regrowth. So if you think about it, the good Lord really put us together in a good way in that the first cells that come to stop the bleeding also start the regeneration process. And they do that because platelets are loaded not just with clotting factors, but also with growth factors. Vascular growth factors, skin growth factors, collagen growth factors, bone growth factors. Platelets go everywhere in the body, and so they have to be loaded with all of the growth factors they need to fix anything, right? So if you draw blood and you spin blood down, you can isolate on the gradient where the platelets are and remove the platelets and then inject them anywhere in the body. So dermatologists use this for hair growth. Orthopedists use this for regenerating cartilage in knees and shoulders. People use it for wound healing. And there was a doctor in Alabama, Dr. Runnels, who used this to inject into the penis, called the P shot, the clitoris called the O shot, use it on the face called the vampire facelift. And then there's been some legitimate research on this, most recently out of Greece, which showed that injecting twice in the penis across about a month gap will improve erectile function, right? But there's never been any study that showed that it improved length or girth, right? Now, in order to improve length or girth, you have to actually stretch something, right? So you could inject PRP into the gums, but that wouldn't make your teeth move. You need braces actually to make your teeth move. You need stimulus, rubber bands and stuff like that to move tissue in the body. And so there was a device developed by a friend of mine, Landon Trost, at the Mayo Clinic called the RestoreX device, and that is the best penile stretching device that's out there. And then there's a vacuum erection device developed by Dr. Joel Kaplan that helps increase the girth, right? And so the penis has two layers of collagen, a lengthwise layer and a girthwise layer. And so in order to improve penile size, you want to improve both the length and the girth, because if you just improve length, then you end up with a pencil penis. And if you just improve girth, then you end up with what I call a pig in a blanket penis.
Right. Yeah.
And I like pigs in a blanket, but not
right.
as a shape of a penis.
Pencils are great, but...
Yeah, and pencils are great. And if you ask women, they care more about girth. And if you ask men, they care more about length. But, it'd be nice to get both length and girth. And, previously there were anecdotal stories about how guys use penis pumps and stuff like that, or traction devices, but you have to use them for like 8 or 10 hours a day. What the PRP does is it accelerates the traction and the suction, the results of those things. And then the final thing is I have a supplement that I created called Affirm, which is a nitric oxide booster. So when I was at UCLA, my professor won the Nobel Prize for discovering how nitric oxide helps open up blood vessels, right? And nitric oxide really comes from two sources in your body. One is from an amino acid called arginine, but really you need citrulline in your body to make arginine, which donates nitric oxide. And the other is nitrates, which you get from green leafy vegetables and things like beets. And so Affirm has citrulline, which is from watermelon, and nitrates, which are from beets, and it improves circulation, because the thing is, if you want things to grow in the body, you have to be able to deliver proteins and nutrients and so on and so forth in order to facilitate that growth. And so I packaged up those four things into a 6-month study. I wrote up the protocol. I got institutional review board approval, which you have to do in any legitimate study. I had it listed at clinicaltrials.gov, which is the NIH website, which kind of brings me to a funny story. I had a patient call from Ohio, and he's like, I want to be in that P-Long study. I'm like, great, well, you live in Ohio. He's like, well, isn't there money in the study from the NIH to fly me to California to participate in the study? I was like, dude, the NIH is trying to cure cancer. They really don't care about growing penises. Yeah. I said, I'm really sorry, but you're going to have to wait until we have a provider.
Or you have to drive out here and stay in a tent or something,
Yeah. Well, I had folks fly in from Florida and New York and Seattle and Los Angeles and Arizona. Guys will go great lengths to increase the size of the
Great
penis.
lengths.
They really, great lengths.
It's funny because this is an issue that a lot of guys don't like to talk about because of insecurity or whatever. But it is, like you said, half of men, when they're surveyed, say that they wish it was bigger, and the other half lie about it. Like, it's like a legitimate concern for a lot of people.
Yeah. I mean, the thing is, over 300,000 women every year in the United States get silicone breast implants, right? And a fraction of those women are women that are recovering from breast cancer.
Mm-hmm.
I mean, so it's just the way it is. It's human nature for better or for worse. Mm-hmm. And so, I really focused on getting this study done, even through COVID. And when I had 16 patients who had completed the study, I analyzed the data. We put the data together and submitted it to, there's a joint meeting this year between the International Society of Sexual Medicine and the Sexual Medicine Society of North America, which are basically urologists and legitimate researchers in sexual medicine. And so my abstract was accepted for oral presentation, which is kind of the highest level of presentation. I presented it at the meeting in Miami a week and a half ago.
That's awesome. And
yeah,
and the reception
really cool
from your work then has also been, I mean, there's a lot of people talking about this now. So
yeah, absolutely. Well, I mean, the thing is, what we found is that you can grow your penis in length almost an inch, and in girth almost a half an inch. And every patient in the study that I talked to said that they had better function. Now, this is a procedure for healthy men with normal penile function, normal erectile function. So it's not really for men with erectile dysfunction, because those guys aren't going to stretch the penis to the full length because they're not filling the penis up with blood flow, under pressure. So this is for, guys 20 to 50 with normal erectile function that want their penis to be longer. And so to assess, we don't really have a validated survey instrument to assess, anything beyond normal. But, if things are working better for a guy, they pretty much know it.
Yeah, I can imagine they would know if it's functioning the way it's supposed to.
Yeah.
So now there's a lot of guys out there who might be like, this is exactly what I needed, right? And there's probably a lot of guys out there like, I mean, like I could use some improvement, but I don't know that I'm ready to go through all that.
Yeah, I mean, that's the thing. If you don't want it, great. If you want more size, more length, and more girth, okay, here's something that's totally safe, mm-hmm. right? There's no surgery. There's no foreign materials. There's no fat transfers, right? All we do is take a 30 gauge needle. It's the smallest needle, right? And inject the PRP, which is your own platelets taken out of your body 15 minutes ago. Inject one on one side, once on the other side. The way I do it is almost entirely painless. We do it under ultrasound guidance, so we have perfect visualization of exactly where we're going, right? You do that once a month for 6 months. And then the other thing is, a lot of protocols say, well, you got to keep your traction device on for 8 hours or 10 hours a day for 6 months. This is 45 minutes in the morning, 45 minutes in the evening. That's doable by most normal human beings. So, if this is important to you, mm-hmm. and I'm not telling guys like, listen, you got to do this.
Right.
I'm saying, if it's important to you, I developed something that's totally safe. It's about a third the cost or less of other options. It should be relatively permanent as long as your erectile function is good, because you're going to be stretching it out to that full extent. And, the other interesting thing is it's a linear growth curve, right? So at the end of 6 months, if you keep going, right, there's no reason why you wouldn't expect to continue growing. I don't, what the limit is, who knows? I mean, I had one guy, he increased his length 1.5 inches.
There's a lot of doctors out there that have for years said that there's nothing that you can actually do to make a lasting impact on this. And this is new science.
It is, but the thing is, like, all you have to do is look at National Geographic and see pictures of that African tribe where the people put those rings around the neck, and people's necks are like, 3 inches longer than, the average American neck, to know that biologic systems are pliable. If you provide pressure and growth factor over time, you can change biologic systems. I mean, that's just the way it is. And so, it's not really, the results I got really, to me, weren't unexpected. But the nice thing is now I can sit down with a guy and give them a reasonable expectation of, you come in for 6 injections of PRP spaced out about a month, and you do some stretching and some traction, and you take this Affirm nitric oxide boosting supplement, you can expect about 1 inch growth in length and 0.5 inch in girth, right? And better function. And you can really expect that there are not going to be any negative side effects.
Yeah, which is huge.
Yeah, absolutely. The thing is, you don't really want, when you're dealing with the penis, you don't want to consider downsides.
Right. Yeah, because it would really be a horrible thing if you're like, let me see if I can make my life better in this area, and then you do something that just completely destroys it. So,
oh God, I mean, I had 3 patients in my practice that had what's called the pneuma, which is that silicone taco that the guys get put in their penis, and then they had it taken out for infection, one because they just didn't like the way it felt, and the other because the surgery was botched. And then they have this massive wad of scar tissue at the base of the penis. So now their penis is 2 inches shorter than it used to be.
Yeah.
And I'm not saying that every patient that gets that procedure has that complication, but maybe it's 1 out of 10, or maybe it's 1 out of 100, or maybe even it's 1 out of 1,000. But is that a chance that you really want to take? And do you want to put $20,000 down to get that procedure when there is a chance that things could go horribly wrong?
Right. Right. Doc, tell me about, you mentioned this at the beginning, and I know this was more for erectile dysfunction, but the electric shock technique.
Yeah. The shock. Yeah. Well, it's not really an electric shock. It's what's called the shock wave. Right. So if you think about a sound wave, you get that kind of nice sinusoidal wave, if you remember from high school physics, right? So what a shock wave is it was actually discovered during World War II when they were trying to blow up submarines and they were setting off the depth charges. And it's just this wave of energy that comes from an explosion or some sort of release of energy. And then in the 70s, urologists like myself harnessed that energy to break up kidney stones inside the body, right? But if you turn the power down and you harness that energy, you can stimulate the cell membranes of vascular cells that line the inside of blood vessels, and trick them into thinking that there's an injury, even though there's no injury. You trick the body into thinking there's an injury, and you get an injury response. And that injury response generates a healing response. And part of that healing response is to grow new blood vessels, right? So say you blew up the Freedom Tower in New York, right? You're going to have to build some roads in there to take out all the debris. And then if you want to build a new building, then you're going to have to build more roads in there to get the building materials in to build a new building. Well, in your body, when that happens, those roads are actually blood vessels, right? So your body is secreting growth factor and activating stem cells that causes the growth of new blood vessels.
So that's what that shockwave therapy is doing, is it's helping in the penis to increase the blood flow by inducing a healing response.
Right. It's called a neovascularization of the growth of new blood vessels. And they're actually experimenting with this on hearts, right? So people have had heart attacks and lost myocardial tissue. You can do shockwave on the heart. Got to be a little bit more careful than on the penis, but that stimulates stem cells and the release of growth factors and the growth of new tissue and new blood vessels in the heart.
It's so crazy how science has gone this direction. There's so much. It's amazing.
Yeah, it really, 10, 15, 20 years from now, it's going to be really magical.
Yeah, it's awesome. So you mentioned the word kidney stones there, and I think it might be worth talking about. You're a urologist, so you've got some experience with it. For whatever reason in the past month, I think I've heard about 10 people that I know, 10 men who have been hit with the dreaded dick bullets. What's the deal with these? What causes this? How do you avoid this? What do we do with this?
Yeah, so kidney stones are basically salts, right? It's a calcium plus, most commonly, it's calcium plus an oxalate. And they come together in the urine, and when they come together, they form little crystals. And every time you get dehydrated, there are more crystals that form. So think about it this way, right? You have a coffee cup, and you put some salt in the coffee cup, and then you pour some water in that coffee cup, right? And as the more water you pour in, eventually that salt will go into solution. Then you take that coffee cup and you put it outside, and the water starts to evaporate. Eventually you'll get to a point where a crystal starts to form, right? And then the more water that gets dehydrated, taken out, that crystal will get bigger and bigger and bigger, right? And so that's sort of how kidney stones form. There's calcium. I mean, there's a couple different types of stones, but most commonly is calcium oxalate. So if you have enough calcium and enough oxalate, they'll crystallize, right? So calcium obviously is an essential ion or substance that we have in our body. It's present in our bones and so on and so forth. But oxalate comes from, most of the oxalate we make in our liver, but a lot of oxalate comes from green leafy vegetables and those kind of foods, which are healthy foods. You know, that's the first thing people always say to me. Well, you know, I'm trying to eat good. You know, I'm eating kale and cabbage and lettuce, but unfortunately, that's where a lot of oxalate comes from. And so if you have a lot of oxalate and a lot of calcium, and then you get dehydrated, you start getting these crystals. And, you know, it's really cool sometimes when we break these stones up with lasers, you actually can see like almost like tree rings. You know, like, oh, that's the time when I did that mini marathon and I got really dehydrated and my kidney stone grew a little bit more. Then I rehydrated and then it didn't grow for a while. And then, you know, I went out on the 100-mile bike ride and I had a leak in my camelback and got really dehydrated. And there's that other ring.
So that stone then forms in the kidney and then.
Yeah. So it forms in the kidney and it forms like. On the inside of the kidney, if you were to slice the kidney in half, you have these things called papillae, which look like little fingers reaching out into the inside of the kidney, into the collecting system. And the stones begin to form on the tips of these little papillae. And when they get big enough, they kind of drop off. You know, or maybe you go on a crazy mountain bike ride and you shake them off. And then the ureter is about 3 or 4 millimeters in size. Right, but it's a straw, but it's a dynamic straw. So it gets bigger and smaller, and so the urine is always. Well, I'll back up for a second. On the outside of your body, you sense touch, right? So if you get pricked with a needle or something like that, it hurts. On the inside of your body, touch is kind of irrelevant, right? Otherwise, you'd be crazy because every time something goes through your intestine or every time something goes through your gallbladder or your ureter, you would feel it. So you don't feel stuff like that on the inside, but on the inside, what you feel is stretch, right? So if you get constipated, you get, gas pains because your colon gets stretched. If you have a gallbladder stone and the gallbladder gets stretched, that's what hurts. And in the urinary system, when the ureter or the kidney gets stretched, it's exquisitely painful. I mean, I've seen grown men just like writhing on the floor of my office like someone shot them in the back from like a 3 millimeter, tiny, tiny little kidney stone. So these kidney stones start in the kidney and then they go down the ureter, and the ureter tube is about 3 or 4 millimeters in size. and it's about 15 centimeters in length. So it's got to make that trip all the way down. And there are a couple of different areas where it will get hung up. One is just as it's leaving the kidney. The other is when the ureter goes over the common iliac artery. And then the other, and most important really, is the tunnel when it tunnels through the bladder and goes into the bladder. And that's typically where kidney stones get caught.
So dehydration amplifies the process, so we should stay hydrated.
Exactly.
And if you find yourself having one and you're in that pain and they diagnose it, how do they treat it?
Yeah, so there are a couple different ways. For the common, relatively small kidney stones, the first thing you really need to do is to get to the emergency room to get an imaging study. And typically what we do is a CT scan, non-contrast CT scan, will just tell you exactly where the stone is, whether you have any other stones, right? Because when there's one, there's usually more than one, and where it's located and how big it is, right? So if it's a small stone that's almost ready to pass, sometimes you just load someone up with pain medication and with fluids, and there's a medication called Flomax or tamsulosin, which sometimes will help kidney stones pass. It's a little controversial, but there's very little downside of that, and things will pass on its own. Okay, there are two really other options. One is to bring someone to surgery and go up through the urethra, which is the tube that goes through the penis, with a flexible scope, and then up into the bladder, and then up the ureter, and then use a laser to break the stone into little pieces, and then to use a little 4-wire basket to pull out the little pieces so that we can send them for analysis and so that the patient doesn't have to pass them. The other option is to do what's called shockwave lithotripsy, which is totally non-invasive. So you basically get put to sleep, and then the shockwave machine gets brought up against the side of the body. You visualize the stone with an X-ray, and then you send really intense but focused pulsed sound waves to pulverize the stone into powder, basically. Now, sometimes it works fantastically well, and sometimes it doesn't work, depends on how hard the stone is. And sometimes you break a stone into smaller pieces, and then you still have to pass those smaller pieces.
Yeah. Well, I am now aware, and I'll make sure to drink some extra water.
Yeah. So, and there's something called citrate, and that's in lemon. And so citrate or citric acid will bind with oxalate and take oxalate out of the system so that oxalate's not available to bind with calcium. So a lot of urologists will tell their patients, drink lemonade, or I used to tell my patients, because I live in California, grow a lemon tree, nice Meyer lemon tree, squeeze a little lemon into your water. And then my wife, who's a dentist, will say, no, don't do that because the acidity will destroy the enamel of your teeth. So
Yeah.
you can't win, right?
Then the calcium from the destroyed teeth leaches into your system. And
Exactly. Exactly.
So what other things do we men need to be aware of that might be affecting our nether regions that we should be working on or taking care of?
Yeah, so one thing that is sort of a public health, not emergency, but urgency, are testosterone levels, right? And, most reports will say that our testosterone levels are 30% lower than our grandparents, right? Or grandfathers, not really grandmothers, right?
Then we'd be really
in trouble. Yeah.
Be like you're 30% lower than your grandma was.
Yeah.
That sounds like a schoolyard taunt, doesn't it?
Yeah.
Your grandma's more manually than you.
Yeah, exactly. So, all right. This is my grandma Mavis. Yeah.
So testosterone.
She'll kick your ass.
And she's got more facial hair than you.
Yeah.
So seriously though, that testosterone level is 30% lower than our grandfather's generation. What does that mean?
Yeah. So, think about it this way. The body is really smart. The body only makes what it needs, right? So if you're a hunter, right, and you're a caveman hunter and you're out on the plains, killing wild buffalo, you need a lot of testosterone, right? Because buffalo are really tough to kill, right? If you're a farmer, you're not killing buffalo, but you're working hard. You need a pretty good amount of testosterone, maybe not as much as a hunter. But if you sit, in front of a computer all day, your body says, well, we don't need that much testosterone. We're not attacking something. We're not lifting heavy stuff and planting stuff all day. So why should we make that much testosterone? And then people sit there with, laptops in their lap. And the heat from laptops, there's a reason that testicles are hanging out outside the body, and that's because body temperature is too high for the production of sperm and testosterone. You're much better off having production of sperm and testosterone at lower temperatures. But if you raise those temperatures, it's not good. And then we eat all sorts of foods that aren't optimal, right? Mm-hmm. With processed and plastics and so on and so forth. And, I'm not an expert at that, but I know that really can't be that good for
I've heard a lot of people talk about seed oils and things like that and soy, how they affect testosterone production as well. I don't know the accuracy of it. But...
Yeah, and that's not my expertise. So I'm not going to, I don't know much about seed oils, and I don't know that much about plastics in our environment and processed food, but, I know that it's can't be all that good for us, and I try to eat more raw foods and raw meat and that kind of stuff rather than hot dogs and that kind of stuff. I think that's more common sense.
If we start lifting weights and eating healthier and putting ourselves in positions where we're basically doing things where testosterone is required, the body will start making more testosterone.
Yeah, absolutely. Also don't underestimate the importance of sleep, right? So there are lots of stuff that happens when you sleep. But first of all, if you look at testosterone's highest first thing in the morning, right? It's not a coincidence. Your body makes testosterone when you're sleeping. And then as the day goes on, your testosterone goes down. Your testosterone's lowest basically at the end of the day. And then when you go to sleep, your body starts to restore testosterone, right? So if you're a lousy sleeper, or you don't sleep that much, it's like leaving the gas station before you fill your tank up. The other thing that happens when you sleep is you build muscle, right? When you go to the gym, you're tearing muscle down, right? When you're sleeping, that's when you restore and rebuild muscle. So if you're not sleeping fully, then guess what? All that time you worked out in the gym is kind of wasted because you're not rebuilding those muscles. You're just tearing them down. It's also a time of psychological repair. Your body replays the events of the day in a way that it can process the importance of those events. That's what, dreaming is all about. It's about processing the psychology of the day. And then the other thing that happens is you get erections, right? And I've seen young guys come into my office with no other risk factor for erectile dysfunction than sleep apnea. They don't get good sleep. And so when you don't get good sleep, you don't get good erections, right? So, you've seen that TV show, Naked and Afraid, right? I love that show. It's like so good for human physiology, right? Have you ever seen the naked people on that TV show hook up?
No, I haven't been paying attention to that part, but I watched it a little bit. So
yeah, I've seen like 40 or 50 episodes, right? And there's like a naked hot guy and a naked hot girl, and they throw them in the middle of the desert or the jungle with no one around for 2, 3, 4 weeks. You would think at some point
gonna happen.
They would sort of get amorous, right? But it never does, right? Because they're all spending all their time getting food and shelter and protecting themselves from the elements and from animals. And so really in nature, the only time that animals get amorous is when it's time to procreate, right? So how does the penis keep itself in shape if that's the situation? And the way it does it is you get nighttime erections. So if you're not getting sleep, you're not getting good nighttime erections, and erectile function will decline.
It makes really good sense. So, oh no. Are you there? Okay, I just had a little hiccup. There we go.
Oh, no worries.
So, Doc, I know that we've asked you some of these questions before, but I we've got you on the show again, so we might as well ask. And if there's repeat of before, that's okay too. But
no worries. You're going to check my answers against the
we're going to
previous
see.
ones.
And you're like, oh, no, he's a phony. No. The first question that I like to ask is, what does it take to be a man?
Yeah, that's a great question. I think as men, we're asked to take care of other people, which is really important. We are asked to take care of our communities, our workplace. But I think really it's really important to also make a commitment to take care of yourself. Because if you don't take care of yourself, then you're not going to be capable of taking care of other people. And so it's that mindfulness of taking care of yourself and making good decisions for yourself so that those good decisions also benefit the folks around you.
Yeah, I think it's something that we neglect. Like we want to serve, we want to protect, we want to provide for, but if you don't take care of yourself, how can you do that?
Yeah. And for some people they're afraid to take care of themselves. For some people they don't know how to take care of themselves. Some people it's never been on their radar. They've always been sort of taught to take care of other people. And it's like when you bring that up to them, it's like you're bringing up a totally like foreign concept. And it takes a while for it to sink in for my patients. Like, dude, listen, you're losing yourself by doing everything for everyone else. Learn how to do something for yourself.
Yeah, I think it's excellent, man.
Yeah, I mean, it's much, much more common than you think.
So let's say that someone runs into that you were able to run into the 10-year-old version of Dr. Judson. Did he want to be a doctor, by the way, when he was 10?
I did,
awesome.
Yeah. That's always been sort of a lifelong goal.
So let's say you've got the chance to...
Not really a dick doctor, but... I mean, that really wasn't on my radar at that point.
What do you want to do all
something
day?
I evolved to. Like I started out by doing kidney transplants, something super noble, and then, I became one of the first robotic surgeons in the country curing prostate cancer and bladder cancer. And somehow or another, I ended up growing penises.
What do you want to do all day? I want to help guys get bigger penises.
Yeah. And God bless my poor kids,
Oh, no, I think it's awesome. So, but let's say you've got the chance to talk to 10-year-old Judson. What do you want to tell him?
Oh, gosh. I think maybe this was a little bit more mature than 10 years old, but I think it's really important that you learn how to be more in touch with your emotions, right? That's one thing that I didn't really develop when I was growing up, was sort of emotional intelligence or emotional competency. We're always taught to kind of shake it off and, don't worry about it. Things will work out, or, suck it up. But learning more how to process those emotions in a way and communicate those to other people in a more effective manner, I think would have brought more sort of enrichment and joy to my life.
I like to ask this question, and I normally ask it, what is your best advice for the men listening today? But because you're a doctor, I want to get very specific about it. What is your best health advice for the men that are listening today?
Yeah, it's super easy. Don't drink, right? Alcohol is poison. Makes us fat, makes us stupid, and it makes us sad, right? It's a depressant. So don't drink, don't smoke, don't do drugs, don't eat too much, exercise every day, stretch every day, meditate every day, sleep well, and be nice to other people.
I think that's really good advice for life.
Yeah. I mean, you do that, you're better off than 95% of people.
That's great advice, man.
You know, then I have my one percenters, so guys that do all those things. Then I have other stuff that I can do for them to take them to the next level. But, you know, for most folks, start out with the basics.
It's very practical too.
Yeah. I mean, you know, it's like we live in a crazy world. It's hard to do those things.
It's
right. And advertisers are out there trying to take your money. Like there are people at beer companies or whiskey companies going, how do we trick these gullible men into drinking our poison and spending money?
right.
Right. I mean, that's like literally that's the discussion. Or, you know, at cigarette companies, you know, how do we trick people into thinking that smoking is really cool? You know, or Dairy Queen, they're like, how do we trick these people into buying a Blizzard, which is 2,000 calories and will just make people fat and diabetic? Right. But that's what they're doing.
Yeah.
Right. You know, it's like I had a patient who is a tort attorney, and he would go after the tobacco companies. And he was telling me that when they make this chewing tobacco, they put ground fiberglass into the chewing tobacco, so it creates these little micro perforations in the mucosa, so that you get the nicotine going through the mucous membranes more quickly. Right? I mean, that's devious.
Yeah.
Right? But that's, you know, you got really smart people with PhDs like sitting there trying to figure out, like, how can we get these people to buy our stuff, even though we know it's bad, even though we know it's addictive, even though we know, you know, like alcohol is 50% of traffic fatalities, like 80% of domestic abuse, probably 90% of the stupid decisions that we make in our life and the really stupid things that we say to other people are done under the influence of alcohol. But we sit there watching beer commercials and whiskey commercials saying, yeah, let's be cool like that guy. You know,
There's so much disconnect from the actual harm that something can do and the profit margin at the corporate level, you know? And I think there's a big difference between, you know, when I was a kid, I had a boss that used to like to chew this tobacco in a pouch. And when you open it up, it was like a leaf. You know what I mean? Like it was just a tobacco leaf. And it was just dried and preserved, but it didn't have all the crap in it, you know? And I'm like, I'm not saying that tobacco is great. I'm just saying, like, what about, like, if we instead of putting all the crap in it, like, actually used it the way that it was meant to be used rather than turning it into profit margins that kill people faster? It's ridiculous.
Yeah. So, I mean, you know, listen, I'm not perfect. I don't ever claim to be perfect. You know, I have my fair share of unhealthy habits, but at least when I eat my Haagen-Dazs bar at 10:30 at night, I know I know the conscious decision that I'm making. Right. You know, like, all right, I'm loading my body with sugar, you know, and driving up my cholesterol, but you know, I just need it at the end of the day, you know, like some sort of reward or whatever.
Well, and there's the difference between the occasional treat versus the constant damaging habit, you know?
Yeah, exactly. I mean, you just have to go into things in a way that's kind of mindful.
Yeah. Well, Doc, if our guys want to connect with the work that you're doing with P-Long or your book or anything else, Affirm Science and any of that, what's the best way for them to make that happen?
Yeah, so go to p-long.com if you're at all interested in the penile enhancement protocol that we put together. If you're interested in the 21st Century Man book, just go to the 21stcenturyman.com, all written out in letters. If you're interested in any of our men's health supplements at Affirm Science, go to Affirm Science, AFFIRM Science.com. And if you're interested in the work that I'm doing at Brandeis MD, go to Brandeis, BRANDEISMD.com. I also have a pretty robust YouTube channel, which is just Brandeis MD. So I do a lot of teaching for other physicians, and I I put together a lot of really kind of cool ebooks so I put a lot of that stuff up on my YouTube channel, and also I have an Instagram that I put a lot of that stuff up into. And I've been getting really into human athletic performance. So I speak for a company called BTL, which makes the M-Sculpt and the M-Cella. I just got a VO2 max testing, which is really just like the coolest thing ever. As I get more into understanding performance, human athletic performance, and performance physiology, VO2 max is like such an amazing metric to test. So anyway, I'm all about, and then I wrote a bunch of testosterone ebooks. If someone's really interested in testosterone, if you go to my BrandisMD.com website and go to under the media tab, drop down to ebooks, I wrote one on testosterone. I wrote one on testosterone levels. So different preparations of testosterone, what levels they'll give you. And then I wrote one for bodybuilders. So people that take performance enhancing drugs. If you're out there and you're taking testosterone at levels for performance enhancement, you really should read this book, because I've seen a lot of guys ruin their sex lives, ruin their fertility by doing stupid things with performance enhancing drugs. And every piece of information that you need to know to make intelligent, responsible decisions about performance enhancing drugs. And I'm not saying don't take them. I'm saying read the ebook. There are things that you need to take in addition to testosterone derivatives to protect your fertility, to protect your liver, to protect against building up too much estrogen, et cetera, and all that information's in those ebooks. So really, I'm out there to help men make good decisions.
Awesome. Well, we'll make sure to link that stuff in the show notes as well. So if you're listening on the podcast or if you're watching on YouTube, just go down to the description and all that information will be there. If you're not paying attention now, go back to manlihood.com and we'll link to that on our website as well. So
awesome. Hey, thank you so much for having me back. I really appreciate it. I really enjoy talking to you.
Yeah, I appreciate talking to you too. I know last time you were worried that you were too serious. I think we were able to laugh a little bit more today, so that's good.
Yeah, there you go. Yeah, I can be funny.
Well, it's serious stuff. There's serious stuff going on, and there's a lot of things we need to talk about and weigh carefully. So I get it, but I get it. You're also a great guy, so it's good to. So. Now, thank you again so much for being on the show, man. I appreciate it.
Awesome. My pleasure.
Doc, as always, I'm so grateful that you spent some time with us on the show, and I'm looking forward to interviewing you again. You've always got some amazing insights and some things that we can talk about. Guys, if the work that he is doing is interesting to you, you can check out the show notes for more information. You can also get his supplements. I'm telling you, this stuff is great. The Affirm is good to help make sure that you can perform, and the support is good because it helps to increase testosterone production, make sure your blood pressure is working good. It's good stuff, guys. So you want to make sure that you check that out. And if you use promo code Manlihood, you'll get a 10% off discount. So go to affirmscience.com for that. But gentlemen, I really appreciate you taking the time to talk with us here on the show and to listen, and all that you guys do to help make manlyhood a success. So I just wanted to encourage you to share this with a friend who might be interested and to let others know about what you're learning here at Manlihood. I love you guys. I care about you, and I'll see you next time.